Medicine Hat put itself on the map in 2015 after its claim to have solved street homelessness. How did they do it? Through housing first, but not housing only. They're using what's called a system of care approach to wrap homeless people with support, starting with a home. And it's working.
This is part 3 of a 6-part series exploring solutions to the homelessness crisis in BC, funded in partnership through Megaphone donors and the Thais Housing Fix project. Chantal was 28 when she found herself homeless. She had been living in a cardboard box in Calgary with untreated mental health issues mounting when she encountered the police. Often, an interaction with the police for someone who is homeless can end in a ticket, a trip to the hospital, or jail. But through Calgary's system of care, she was connected with detox, housing, a caseworker, and mental health supports. Thanks in part to the wraparound support she received, Chantal has been housed and feeling healthier for 5 years. Housing First is a model that provides immediate access to subsidized housing and support for someone who is homeless without having to jump through any additional loopholes.
According to BC Housing, it's a strategy they've employed in the province for 10 years. But in that decade, BC hasn't seen the number of people on the street decrease. What can we learn from our neighbors' relative success?
Medicine Hat, Calgary, and other Alberta cities have adopted Housing First as a part of their system of care approach to tackling homelessness. System of care requires a lot of coordination between services, but that's what can make it so effective. It wraps homeless people in support, starting with a home.
What can BC change about our approach to Housing First to mimic some of Alberta's success?
First, there isn't enough housing to immediately house everyone, by far. There are roughly 15,000 homeless people in BC and more than 10,000 people on the wait list for BC Housing. If someone comes onto the BC Housing radar, they are either bumped to the top of the list if they are in dire need, or they are set to wait a long time for housing. We need to boost our affordable housing stock. Second, we need more caseworkers, as most are dealing with double or even quadruple the number of cases they're supposed to. They're overstretched and can't provide clients the level of care and attention necessary. Third, we need to coordinate wraparound services. This means creating clear channels of communications between shelters, housing providers, detox, mental health, health clinics, and more.
Alberta's experience shows us that it's possible to tackle the homelessness crisis. We need to connect the dots. We know it works.